Anthony here was born with a natural immunity to some diseases, but those defenses are going to last only a few months. That's why pediatricians strongly urge parents to stick to their child's immunization schedule. Unfortunately, many parents still don't see the value of the vaccines.
I think one of the biggest myths is the idea that if everyone else gets vaccinated, I don't have to. Or if I have a healthy child who, is never sick, then he won't need that vaccine. Certainly not what the CDC and American Academy of Pediatrics recommend.
In fact, what they do recommend is that every child should receive immunization for 11 different diseases before 2 years of age. Those diseases are measles, mumps, rubella, diphtheria, pertussis or whooping cough, tetanus, Haemophilus, influenza type B, polio, hepatitis B, chickenpox, and pneumococcal disease, which can cause meningitis. Children should also receive follow-up vaccinations at 4 to 6 years and 14 years of age. Those booster vaccines are a vital component of the immunization schedule. Take the pertussis vaccine, for instance. The protection from the vaccine wears off after 5 or 10 years. That's why we're now seeing outbreaks of whooping cough. Dr. Fessmeyer also points out that parents who put off getting their child vaccinated are not only exposing their young one to disease, they're also delaying the inevitable if they plan to enroll the child in daycare or a public school.
To be an accredited daycare and an accredited school, you have to demonstrate that your children have completed their immunization record, and people actually follow up on that, has kept our country well immunized and pretty much disease-free.
Some parents are hesitant to immunize their children for fear of side effects, but doctors say the benefits of today's vaccines far outweigh any potential risk.
In the 18 years I've been here, we have had 0 patients have the long-term side effect aspect to the vaccine. We have safer vaccines today than ever before, and the likelihood of that happening may always exist, but it's so incredibly rare that we don't let that prevent us from vaccinating. And the second point is the disease itself is much more likely to cause these severe side effects than the vaccine would.
That's why Anthony's mom is making sure her little guy is getting the best shot
One more.
at a healthy life.
All finished.
Done. All done. You're all done. It's okay.
For Smart Medicine, I'm Lorraine Cachola.